in the female reproductive tract. And these ideas were put together by a number of different embryologists back in the mid-90s, and certainly in the United States it has become the dominant approach. There have been very few studies which have actually compared one or two-step protocols head-to-head, but I will show you some data shortly which we did that exactly in a prospective randomized study. We initially, though, developed and looked at the culture media that we use in this wonderful piece of instrumentation. It's just a fancy incubator which enables video footage of each individual embryo to be taken. It actually captures an image every 15 minutes or so and then runs it in together to make a time-lapse video record of the embryo development. It's the EmbryoScope from a company out of Denmark called Unisense. And I won't go into this too much, but it's a wonderful tool to enable you to actually observe an embryo without actually having to remove it from the embryo. So it's a very stable environment, and it means the embryologists can stay at home with their iPad and check on their embryos with never having to go in the lab for at least 4 or 5 days. I like this. But for us, it was instrumental in doing some initial studies, and that we did many, but these were 2 that were published or are presented at the American Society of Reproduction 2 years ago, and then 1 year ago, or half a year ago, in 2010 and 11. The first one just was a simple head-to-head comparison of our standard culture medium, which we used for 9.5 years, which is the Sage product, Quinn's Advantage medium. And we compared that with the original single-step medium, SSM, from Irvine. And what we showed was that if we just looked at the traditional bioassay using growth of mouse embryos out to the blastocyst stage, if we just used that, we would see here the data were insignificant between the two media. Suggestion that maybe the single-step medium was a little less successful, being slower in terms of this transfer to fully hatched or all hatched blastocysts. But what we found using this instrument, we could backtrack using relatively small numbers of individual mouse embryos and found significant difference in the performance of these two media at the compacting stage and at the cavitation early blastocyst stage, showing a slight advantage, sure enough, to the Sage Quinn's Advantage medium. Big deal. We sort of forgot about this study, but along the way, Irvine said to us, well, take that single-step medium and help us try and develop a better one. These things I have already mentioned. I apologize for these pictures, but they keep me interested while I'm talking, either my children or motorcycles. Forgive me. In a second study, utilizing a single-step medium in the time-lapse approach, and these were the conditions: 6% CO2, 6% oxygen, 88% nitrogen, starting from one-cell mouse embryos. Again, looking at traditional scoring approach of full hatching, or the hatching percentage on this time, 4 or 5 days out. We compared head-to-head 3 different arms in this study. The Sage medium, again, single-step medium, but we also looked at the potential here, the difference between either using single-step medium without renewal, or if we changed it out after several days, as we do with the Quinn's Advantage medium. And ultimately what we found was there was no significant difference at any point through the developmental stages of this product, of these 3 different media approaches. But there was a slight suppression of the development in terms of when the single-step medium was renewed. This study was done at an earlier stage of development of the single-step medium prototype. It was the second iteration, and so with slightly more tweaking, we came to a point in studies which have not been presented before, and I don't have time to show now, but we came to a comfort level with this single-step medium approach without renewal, using this newly presented product. It was actually the third prototype of single-step medium, which is referred to as embryo choice. And the embryoscope enabled us to observe initial preclinical trials in the humans using human embryos, but within 6 months or so of development of this medium, we became comfortable in preclinical trials with actually utilizing this live in a clinical study moving forward. We were very cautious at first comparing embryo choice and SAGE media by taking good prognosis patients, and just below here gives you an idea. These patients were younger and they were good responding patients, and they had to have a minimum of 10 normally fertilized eggs to enable us to have a good split between the two media. At first, we just committed 1/3 of the cohort of these embryos in the first 25 patients to this new medium. We didn't want to be too we didn't want to risk the patients by putting too many embryos in this new medium. However, within the first 25 patients, we got a very good comfort level. We then flip-flopped and put 2/3 of the next 15 patients in this medium, and ultimately we just ran 50-50 comparisons, splitting between these two media. Ultimately, this study was, or initially was, the media, the embryos were split into the two media on the first day of development, and randomly the zygotes, the fertilized eggs, were placed into the two medium. The way we culture, I'll come to in a moment, but we actually group our embryos in up to groups of up to 5 in 500 microliter droplets under oil, and we utilize a mini incubation system from Cook, the mink. The embryos in the single-step embryo choice were not changed over. However, their sibling embryos were changed over from cleavage stage medium to the blast medium very early on day 4. Ultimately, looking at initial studies of some 900 or more embryos split between these two media, and then choosing embryos regardless of their source based on morphology and quality, we would either transfer, a few of the cases transferred day 3, but the vast majority were transferred on day 5 or a few on day 6. And all other quality blastocysts were vitrified on day 5 or 6. Ultimate outcomes are judged by fetal cardiac activity. And in a few of these patients, we became so comfortable with the embryo choice. In 8 patients, we actually utilized the embryo choice medium as the insemination medium to see if it would work effectively. But first, in terms of clinical outcome, we have a very conservative take on blastocyst quality based on its utilization rate. That is, a composite. How many of all fertilized eggs end up making blastocysts which are either transferred or vitrified on day 5 or day 6? And if we look at the overall results on over 1,000 embryos from over 100 patients, we showed an identical blastocyst utilization rate regardless of the type of medium. But if we look at that data a little more carefully, on day 5, that is at the earlier point, we are choosing more blastocysts out of the embryo choice than from the SAGE routinely. And on day 5, we are vitrifying more embryos from the embryo choice than the SAGE. So there was a higher percentage blastocyst utilization rate from the embryo choice on day 5. But this flip-flops and changes on day 6 with vitrification of fewer blastocysts from the embryo choice and more from the SAGE. So overall, it's clear that there is a slower development of embryos in the SAGE sequential medium in our hands, in our laboratory. Ultimately, looking at clinical outcomes from this randomized study, what we found was that when we chose a single blastocyst for transfer from these patient groups, implantation rates, whether from embryo choice or from SAGE, were similar when just one embryo was transferred. But in all other transfers where even if it was 2 or 3 embryos were transferred, where they were all from one source, embryo choice, or from SAGE, Quinn's Advantage medium, we showed a significant jump in terms of overall implantation rate here from embryo choice versus the SAGE product. So this, although we were really seeking to just make our process in the lab easier, and the fact that the embryo choice was giving us better implantation rates was cream on the cake. It was an unexpected benefit. If we look at more data, this runs through the end of February in terms of blastocysts vitrified. No, through the end of last year, we show that significantly more blastocysts per patient were vitrified from the embryo choice. And if we actually, in a smaller number of cases, but where we have subsequently warmed or thawed embryos vitrified from the different sources, whether embryo choice or SAGE, very similar cryosurvival of the blastocyst, but here a very notable jump in terms of ongoing pregnancy per transfer or overall per thaw from the embryo choice product. So very early data, but nevertheless very promising in terms of the success of this medium to grow healthy blastocysts for cryopreservation. Just a small number of cases looking at insemination, conventional insemination, not ICSI, but when we utilize embryo choice, we show not necessarily significant improvement in terms of fertilization, but at least a very healthy comparison with insemination using SAGE HTF medium. So clearly embryo choice supports normal fertilization. So lessons learned. Embryo choice can be used as a true single-step medium for uninterrupted culture. Supports normal fertilization after either conventional or ICSI insemination. Potential increase in implantation rates, and I'll show a little bit of clinical data in a moment, just from the ongoing program, and a definite higher blastocyst formation and utilization rate with faster development from this type of medium. I won't dwell on this. This is very boring embryology talk, but we do supplement embryo choice with 10% SSS, protein product, and having opened a bottle, we only use it the first and the second day. We do our insemination in up to 100 microliter droplets of embryo choice under oil, which is probably an approach many people use. But once we have established fertilization here on day 1, we move our embryos into these 4 or 5 well dishes, into 500 microliters with up to 5 embryos in each well.